All right, we're back here at GameFace TV, and today we are talking about a painful subject for most, including myself, and that is lower back injury. Specifically talking about the lower, the lumbar section of the lower back, spine. So I was compelled to make this video because of all the lower back injuries I've encountered between people that are family members, students of mine, and so I just wanted to touch on some basics, right? I'm not a chiropractor, I'm not a spinal doctor, but there are some basic commonalities I see that most people can avoid the problems they're having if they just follow these basic principles. So I myself suffer from a bulging disc in my lower back that I injured while I was working out, but nevertheless, most of the lower back injuries I've seen from all people, there's one big common denominator amongst everybody, and that is really poor posture. Everybody who I've encountered with lower back injuries, they all suffer from really bad posture. They don't sit with their spine in what they call a neutral position when they're sitting down, which is basically looks like this. But when I look at them while they're sitting down for more than a few minutes and they get comfortable, they automatically default to this rounded back position. And one thing I've learned that I believe is true is when you're sitting down, for one, there is pressure on your spine when you sit down, unlike what right now when I'm standing up. So when you put that loaded flexion pressure, this is flexing the spine, right? When you flex your spine and you're sitting down and you put that pressure, it kind of opens up the spine, and it can cause a bulge in the disc and other things. So that is just something you never want to do. So, the one big takeaway from today I want everybody to get is you have to execute good posture at all times, especially when you're sitting down. Number two would be do the least amount of sitting as possible, which is going to be hard for some who have to sit at a desk every day, but just really mitigating that, and if you can stand up every few minutes or so, but really not allowing yourself to sit down for too long unless you have to. Also, what we're looking at is, you have to go get checked out by a physio, a chiro, somebody who's a specialist. So make sure if you have lower back injuries, you get checked out. But the main thing is, what I've seen is no matter what you do, you go to a doctor, if you're not willing to fix your posture, you're almost pretty much throwing your money down the drain, because injuries always start with movement. And when you look at an injury, you have to look at that pain from the injury is your body telling you that you're moving incorrectly. That is your body telling you, hey, you did something wrong. So the main thing is you can get treated, get your treatment, but if you're not going to fix the original problem, then the symptoms, you're going to treat the symptoms instead of the problem, then the problem won't go away. So you want to treat the problem and not just deal with the symptoms. The symptoms are the pain, but the problem is maybe your posture, you're not in a good position, you're not picking things up correctly, you're not sitting correctly. So we have to start on that first, and that's something you can do on your own. You don't need a doctor for that, but you definitely need to get checked out if you have a lower back spine injury. So take that away for today, and I don't want to catch you out there sitting out with that rounded back, looking like the Hunchback of Notre Dame, all right? So fix your posture.